Good morning, everyone. I am Deborah Rose with Realty One Group in beautiful Payson, Arizona. We're getting ready to start our talk show today. It's going to be very interesting. But before we get started, I wanted to thank Cameron Davis and Razor Thin Media behind the camera, who is producing this show for us, and his wonderful son, Chaz. So we've had a little bit of change of personnel in the first interview. Lance Porter was called out to Page, Arizona, to help the hospital out there, and we were very, very fortunate to have a very special guest, Dr. Cynthia Booth. I believe you're the Chief Medical Officer
I
at
am.
Banner.
Yes.
So welcome to the show. It's so
Thank
nice
you.
to have you.
Thank you so much.
There's
Thank
been
you.
a lot of concern in our community about, the virus and what's going on with the hospital. We've seen people having medical emergencies and being transported, and then loved ones not being allowed into the hospital. So can you speak to that and tell our audience what is really going on?
Absolutely. This is a scary time, folks. We know what's coming. We see what's going on in the world. We see what's going on in our nation. And right now with Banner, we are just really trying to take any and all efforts toward what we call flattening the curve. So flattening the curve, Deborah, is where we just try to avoid any and all exposures that we can. That's it. Exposures to the community, exposures to our patients, exposures to our healthcare workers, who we direly need at this time to stay well and stay functional in order to take care of all our patients, not just our concerning COVID-19 patients.
So that brings up a really good point. Our hospital is really small. It has how many beds?
Well, we actually are in process right now of increasing our number of beds. Yes. So whereas typically we would be a critical access hospital with a maximum set at 25 beds inpatient, now we're going to increase our capacity.
Fantastic.
So,
does that also include ICU?
It does. Yes.
Okay.
Yes.
Does this hospital here have any shortage of equipment, respirators, ventilators, those types of masks that you're seeing in other hospitals around the nation?
We are all seeing either some shortage or some concern for that. Here specifically at Payson, we're looking good. We've been able, like I said, to access some additional beds. We have our ventilators. We have a plan going forward for, kind of separating individuals that need to be, separate in the hospital. We have a plan for many, many people needing care at this time. And as far as specific needs, I just have to say probably masks. That's the biggest thing. So we're looking for donations for that. Just anyone who knows anyone, any connections, that's always appreciated.
Well, we have a lot of quilters in this area, and they're making the cloth, the triple cotton masks. Are those valid for you, or do you actually need the regular surgical type masks?
That's a great question. It's a great question. Those are called social comfort masks, and a lot of people like to wear them. Evidence would show that they probably are not protective. And in fact, if not cleansed properly, can actually be exactly the opposite and perhaps increase your risk of infection. So you just want to be careful with that. It's not Banner's stance to not necessarily use them, but if a person, after doing their research, wants to use them in the community or what have you, then yes.
Okay. So there are people out there that I've seen on Facebook and within the community that say that there has been little to no testing at all of the COVID-19 virus. Can you talk to that and tell us exactly what the reality is, and then what the criteria that needs to be met before they'll be admitted to the hospital?
Absolutely. Let me first say that first and foremost is reducing your exposure. Okay, so staying home is staying safe, good hand washing, also staying at home if you have mild viral, cold symptoms. What we want to see come to the hospital is if you are truly feeling very ill. Okay, the majority of this really does heal well at home on its own, like any other cold or flu. Okay, there is obviously a higher percentage that are going to need hospitalization, and so just having some symptoms doesn't necessarily mean you need to rush right in. But to the testing question, if you do have those symptoms, those need to be validated before you get testing. We need to ask you certain questions, and we do not have a testing site here in Payson. However, I know Banner, as well as some other, companies have set up some testing sites. Banner has 3 down in the Valley. We also have 1 set up down in Tucson. It would be lovely if we could go ahead and get one set up here, I know, and we are definitely looking at that. So more to come. I'm sure that if we do get a testing site up here, it will be just blown out there in the media, so everybody knows.
Well, I know in other states, like my sister's volunteering in Detroit, and they're having these drive-through testing sites.
Yes.
Because that's safer for everyone involved. Are you looking for maybe like a drive-through commercial building to help expedite that type of thing?
It would be that kind of a setup, similar to what Banner has already done in the 3 sites down in the Valley and then down in Tucson, whether it be a temporary building or a tent or something like that, yes.
Okay,
yes.
That's good to know. Mm-hmm. So the criteria for the testing then would be what? I mean, you're not just looking for 1 or even 2 symptoms, but what symptoms do you need to see before you recommend a test?
Great question. It's fever and respiratory symptoms, specifically cough, shortness of breath.
Okay.
And there's some others as well, but those are 2 main ones.
Okay, that's really good to know. Cameron, do we have any questions yet?
Yeah.
Okay. All right. So we'll just keep talking.
Okay. Super.
How do the doctors work in our hospital? Do you have enough doctors and personnel, or are you rotating physicians from the Valley?
I'm so glad you brought that up.
Oh, good.
This is a really hot topic in my office right now. So I actually was hoping to get to use this opportunity. So we are, throughout Banner, we are mobilizing staff where needed, okay, and we're able to do that. As far as our doctors and our other healthcare providers, like our PAs and nurse practitioners, yes, we are actively looking to our medical staff who are already on medical staff, as well as those in our community here who are not on the hospital medical staff. I'm going to be reaching out to them personally to see, to gauge any interest in helping in this time. That's part of our what we call surge planning. We have hospitalists at the hospital, 24/7 availability, there. But if we get to the point where, we have significant respiratory patients, we are going to need to make sure that we have adequate physicians and PAs and nurse practitioners to take care of all patients.
Okay.
Yeah.
That's really good.
Yeah.
So,
yeah.
Dr. Booth has just put out a call for interest or help for those of you that may be retired retired nurses, people that have time and courage on their hand, right?
Absolutely.
Okay.
Absolutely. And I am, like I said, actively reaching out via email. I'm going to be making some phone calls. If you are interested in this, please call the hospital. Can I give a number?
Yes,
is that
please.
okay?
Give all the information you need.
So our medical staff services, sorry, I was touching my mic. Our medical staff services office would be who to contact, and that is the 928 local number 471-1273. That's 471-1273. And our medical staff services office would be able to help and guide. Like I said, we're currently working on kind of a grid for that, what their skill set is, what they might be willing to do, and perhaps skills that they maybe had in the past that they need to bring up to speed, helping them get those skill sets back up again. Yeah,
that's wonderful.
We have one question for Dr. Booth is, have you seen anybody with symptoms of COVID-19 as of yet?
Okay, so just in case people can't hear Cameron, the question is, have you seen yet anyone with the COVID-19 virus symptoms?
Yes, we have seen that. We have not had any positive tests, and there are none in Gila County either at this time.
Okay. So how do we get tests going up here, other than, I know that you're working on it, have you been able to, is anyone in the hospital talking to the governor about getting those tests to this area?
We're working through Banner specifically, but that could certainly be a thought if we had some forward thinkers there that wanted to reach out to that office, the Department of Health, just for any possibility.
Okay.
Sure.
So when they're exhibiting symptoms, they are being asked to go home and quarantine, or are they being asked to go down and get tested at one of the sites in the valley?
Well, I think, yeah, it depends. I think that's really, kind of a mixed bag. On one front, to reduce exposure, right, is to stay home. On the other front, epidemiologically, which means just seeing what's out there and what's going on in our community, to get tested would be helpful as well. So I know that sounds like a little bit of a mixed guidance, but if one is at high risk for the disease, and we're talking people with chronic conditions and elderly, that would probably be the ideal person to get tested, so that we have awareness of that, and that they would know, certainly if they started having more severe symptoms, to seek care right away. If you are young and healthy and just feel like you've just kind of got a cold, maybe you're that person that wants to stay home and reduce exposing others, if you at all can. If you need to work, that's another ideal person that needs to get tested.
Okay, so but the hospital is willing to take in patients that are exhibiting a fever and lung issues or pressure in the chest.
Yes, of course.
And you will accept those patients.
Of course, absolutely.
Okay,
yes,
that's good to know.
Yes.
Okay.
And going forward, we also have a plan for being able to even extend our emergency room if needed to, accommodate for those patients specifically.
Is the ER open for people
to
go in?
It sure is.
Great.
Yes,
okay.
Absolutely.
One more question.
So is there any truth to the rumor that a second homeowner came up from the valley last weekend and presented symptoms here at Banner and then was sent back to Phoenix?
Not that I am aware of. I can't answer to that because I just don't know if that person came through the emergency department or was hospitalized or what.
Yeah.
Not that I'm aware of.
I think there's a tendency to want to, blame others for bringing the virus up here from the valley. But the reality is the virus is everywhere now anyway.
Yes.
And there's not only is the COVID virus apparent, but there's also thousands of other viruses that are still in circulation.
True.
So we want to mitigate some of the fear. There's people that are saying, well, I had a cough and a persistent cough and a fever that wouldn't break back in November, December. Is this I'm sure I've had it. But honestly, until you're tested, you shouldn't be spreading that kind of information out. Would
we
you
just
agree?
don't know. I agree fully. Yeah, we just really don't know that information. Influenza is still around.
Yes.
Other viruses still around. Absolutely.
Allergies, big time.
Still
And every
around.
time Cameron's got allergies.
I'll just encourage the basics, which is good hand washing, wear a mask if you do need to go out in public. to protect others. This is a virus that is spread via droplets, okay? So that means coughing, sneezing, and what the mask does is it literally acts as a barrier to catch those droplets as they come out of your mouth and nose, okay? That is key. I just can't stress that enough, and the good hand washing.
Absolutely.
Yeah, hand sanitizer.
We have a couple more questions for you.
Let's go ahead.
When did you guys start testing for COVID at the Payson Hospital? No?
In March. I mean, earlier March, yeah.
Okay.
Yeah.
And then, so why can't we collect test swabs locally and send out to labs for testing?
So why can't we do the testing and then send it down to the lab to get the information back?
That's a great question. Again, the testing needs to be done by order, and at this time, still the recommendation is to have symptoms before you're tested.
Yeah.
Okay. And so in order to do that, you either need to be seen by somebody or one of these drive-through or, such collection sites.
And there's another option. I know Dr. Alan Michaels has been a huge proponent of telemedicine for many years.
Yes.
So are there doctors in this town like Dr. Michaels that are using telemedicine where they can get on the camera with you and identify the needs of the patient?
I know that Dr. Michaels and Dr. Hunt in his practice are actively doing that.
Okay.
And even doing home visits as well.
Okay.
And I don't know if that's only for established patients. I can't speak to that, but yeah, there is that going on.
So one of the great barriers is if you do have Dr. Michaels or Dr. Hunt as your doctor and you're a current patient, you can do a telemedicine conference call with them and eliminate the need to go into the hospital, because doctors' offices they're not allowing patients to come into the waiting rooms anymore.
Well, let's back
they?
up because
Okay.
actually, if you are having symptoms, we do ask that you call ahead to your office, to your medical practitioner's office, no matter who it is, okay? They have the ability to see you, and they have the test kits and the ability to do the test.
Got it.
It can't be ordered and then you show up to the lab and get it done.
Got it.
So that is not being done at any Sonora Quest or other LabCorp location.
That's very good
Okay,
information.
it needs to be done with a medical practitioner's office or a collection site, or the hospital, obviously.
Okay.
Yeah, urgent care. Shall I add that? I'm sorry, Banner
yeah.
Urgent Care also.
And Banner just took over the urgent care here
Yes.
at Payson. Is
Yes.
that correct?
That's right.
So you're saying that they need to call their physician first.
Call ahead first wherever you're going to present.
Okay.
Wherever.
Okay. Call before you go into
Yes.
urgent care, into the ER if possible. If you're having a different type of medical emergency, of course not. We're just specifically talking about the symptoms as they relate to COVID-19.
Right.
Okay.
Right.
Okay.
Absolutely.
Any other questions?
Yeah.
And that was
Okay.
extremely helpful. Do you have any
Thank
closing
you.
thoughts, Dr. Booth, about anything we might have missed this
No,
morning?
I don't think so. I think we touched on all the major topics. Thank you so much for having
my
me.
gosh, thank
really
you for
appreciate
coming.
the opportunity to come and
Yeah.
talk with you and your viewers.
Yeah,
This is
thank
great.
you. And for those of you who are listening, make sure you spread this show around to your neighbors. Share it, like it, comment it. Make sure this information gets out. It's very critical. We want to keep everyone safe. So thank you. We're going to have our Mayor Tom Morrissey come into your seat while you're exiting.
Okay.
And we are very
Thank
grateful
you
for
so
your
much.
expertise.
Thank you all very, very much. Elbow. There you go.
Bam.
All right.
Yeah.
Thank you.
And while the mayor is coming in, I wanted to share another website that is extremely helpful. Arizona, azgovernor.gov has a ton of information for those of you who are struggling. That website will give you help if you need information about financial assistance, if you can't pay your utility bills, if you need food from the food bank. azgovernor.gov is a phenomenal resource for people who are beginning to struggle. They also do have a COVID-19 hotline. I've tried calling it several times and it's been busy every single time, but you can try 211 and that will take you to the governor's hotline regarding this virus. So there's lots of information for you out there. So please utilize that. Get yourself educated. as we continue to keep Payson safe, and of course this country in general. And I want to thank you, Mayor Tom Morrissey, for joining us today. I know that you have had quite a run the last 2 or 3 months, haven't you?
Well, yeah. It has been interesting, Deborah. I appreciate the opportunity to come on your show.
Yeah, well, it's our pleasure. And I know that you're working hard. You've created some executive committees to help keep Payson safe. So why don't you elaborate on some of the things that you've been working on?
Well, acting town manager Sheila DeSchaff and I put together a crisis management team. It's composed of the fire chief and the police chief, Sheila, and myself. Okay. And what we're doing is we're a central point for action and for information and for the gathering of information and then distributing it, as we've been able to do. The main thing that I'm finding out is that we have an incredible community here. I mean, people just come right up to the door, offering their help, offering resources, and I just stand there and smile about it because it's such a good feeling to know that. But we have been, our days usually start, mine usually starts at about 5 o'clock in the morning, and answering emails and things like that, with a cup of coffee, of course. And but I go on the air every day, every weekday on KMOG with an update at 8:40 in the morning. They're going to expand that next week, I believe, so it'll be a longer show. And then we have meetings. We have a coalition, Concerned Citizens Coalition, that people just in town, the volunteers, the food banks, the providers come together and are working to help the community, getting groceries to seniors, getting food to the school kids and to families in need, and it's just people helping people. Mm-hmm. We have our challenge, I think our greatest challenge right now, are people coming in chartered buses and going into the stores and cleaning out the shelves. Now, over the weekend at Walmart, 3 charter buses came up from the valley and went in and cleaned the shelves out. Now, there's no way to police that. There wasn't any way to police it until Monday, when the president, I got a cough drop.
That's okay. That's okay.
On Monday, the president issued an executive order banning hoarding or overbuying. So now we have some teeth in our ability to mediate that.
Good.
Okay? So what the stores are doing is they're opening early. I know Safeway and Bash's and now Walmart are opening early for the senior citizens to get in there and get their basic needs met. And I've been going to the stores in the mornings too. That's another part of my day. And talking with, I always say I'm getting with the homies, you know, and talking with them about, you know, what are their needs being met, and just to keep everybody calm. There is no need to panic. Believe me, we have the best of the best in Washington, D.C., in our county, in our state, managing this thing. And I've been on the phone almost every day this week with Senator Sinema or her staff, and about the stimulus package that's going to be coming. And I want to get the message out to businesses, first of all, that they need to stay open and operating for as long as they can. Now, when or if we get our first case here in Gila County, then bars and restaurants are going to be forced to close. But up until then, and even after, they need to keep the staff, keep their staff and keep their payroll going, so that they'll be eligible for grants. Now, they're going to be called loans, but they're going to be grants from the Small Business Administration, the SBA. It sounds really cool, but keeping them functional, because that money will flow into the businesses, and they will not have to pay it back. Okay, those that close are going to have to go through the loan process. Now, this is all going to be handled by banks. The money will come through the federal government. But it's incredibly important that they stay as viable as possible. And I've been going around town talking with business owners and managers to try to get that message across to them. That's imperative. They have to do that. We have the governor is handling this, I think, in an extraordinarily great way. I've been on the phone with his staff every day, sometimes 2 or 3 times a day. And what he's providing in his executive order is a very, very basic thing. There are no evictions going to happen over the next 120 days.
That's fantastic.
Okay, which is really a relief to a lot of people. There's an expansion of telemedicine in that people that ordinarily they can do telemedicine would actually go out having to go into a doctor's office to be able to enjoy the benefits through insurance, and it'll be available. It's going to be available to everyone. You know, this is a crisis for all of us, and it's something that we all have to solve and meet. The main thing is that we don't take advantage of one another. We don't take advantage of the situation, like cleaning out the toilet paper stock, and then going and selling it for 10 times what was paid for it. I mean, just things like that. And again, I say, do not panic. We have it under control. We know what we're doing, and we're moving along. We have experts here in our town. Our fire chief, David Staub, is an expert on this. Our police chief, our new police chief, it was a blessing. Ron Tisher is an expert on this. My experience has been in crisis situations. When I was in the Marshal Service, I helped restore order in the Caribbean, in the Virgin Islands, after some pretty bad hurricanes. But that was a law enforcement thing. It was a lot easier to do. This is so comprehensive. It's a much bigger challenge. But the fact remains that we have to stay calm. Panic will bring nothing. It doesn't solve any problems at all. All it does is make it worse. And you have to trust the system. Okay, we have the right people in office at the right time to meet this challenge, and meeting it they are.
So you're saying stay calm and carry on until further notice.
Right. I usually say stay calm and call Batman. But
okay.
Cameron.
Looks like we might have a question for you, Mayor.
Yeah.
So a couple questions actually. What is the need of our current food banks? Can you talk about that?
What is the need?
Of our food banks.
Our food banks are bare. The shelves are bare. We're having trouble getting food to them. The need is growing for the food banks. So we're working with people like Chuck Proudfoot and some of the community activists at St. Vincent de Paul. And we're trying to get we have food boxes, donation boxes, like in Safeway and Bash's. But the problem there is contamination. So when although there's cans of food and everything, but they can be contaminated. So that's a challenge. And the store managers are trying to deal with that. So it's complicated. The National Guard, the governor has put the National Guard into the business of transporting food, getting food to the stores. The problem in the stores is getting it onto the shelves, getting the food onto the shelf. So we're working with that. Every day brings us a little bit closer to solving these problems. But we've never faced anything like this. I don't think anybody alive today has ever faced anything quite like what we're facing. But we're learning as we go. And and there's a thing called American ingenuity, and that's what's coming into play. That was the thing that won the Second World War, by the way. It was American ingenuity, and it probably caused it too. But the thing is, the spirit of this country is great. It's robust, and we're meeting the challenge. And I'm not just saying that. I'm seeing it every day in action.
Yeah.
And it's amazing. Yes, Cameron. I'm sorry.
And you probably want to repeat this.
Yes.
Because they're saying they can't hear it when I ask it. But the other question is, there's been a lot of concern and rumor about the governor shutting down the state and using National Guard to do that. Is that true? Is that just a rumor?
So the question to you, Mayor, the former question, by the way, was what is going on with our food banks? So the mayor addressed that question. The second question is the state is using the National Guard to shut down the state and start delivering food and all these things. Do you think that is needed?
No, that is. I believe that those questions are based on an overreaction. The National Guard is not there to shut down and shut the state down militarily. They're there to help. They're there to assist in transporting food. We're not at a stage where anything like that has to happen. I mean, we are not there. And the governor has his finger on the pulse. The man knows what he's doing. And he's got the right people with him, around him, as does the president. And I am blessed to have the right people around me here as the mayor of Payson. I mean, I've got some really substantial people that really understand what to do. The main thing is to answer that question is don't get caught up in this panic thing. I mean, I've had people calling me at 10:30 at night wanting me to close down 87 and 260. So my response is, how do you think I could do it? Go out with a lantern and stand, I mean, I don't have control over the state highways.
And that would require, honestly, like martial law,
right,
which would then really set panic in the air, correct?
And it would shut down transportation. We can't do that, and we don't need to. We really don't need to do that. So, I do welcome suggestions from everybody. I want to hear as many opinions as I can, because a lot of times there are solutions to that. But there's no need to panic. I mean, really.
I think there's incredible people that live in this town, and yes, Payson's very friendly, very kind. We've got a lot of military, we've got a lot of retirees that have significant backgrounds, and they have skill sets that we could utilize as a community right now. So
right,
for those people that are out there that want to help in some way, what would you say are the top 2 or 3 things that they can do to help? Is it donating money? Is it donating their time? What do you need, Mayor?
Well, if they would join the Coalition of Concerned Citizens, that group.
How do they do that?
Well, call Town Hall. That's the number.
Okay.
472-5026. I never call myself, so I haven't memorized that. But but call there and start there, and we'll give them direction as to how to join these groups. We're going day by day. We're adjusting and when we're advancing, and there's new numbers coming into play. And the main thing is, as stated before, is the governor's website, azgovernor.gov, and the town website. And call. Don't hesitate to call this number. And when you call 472-5026. The menu will come up, hit 0, okay, and then it'll bring you to Michelle or Audrey, and they have an updated advisement every day.
That's good. And then there's another website that Cameron brought to my attention this morning. It's called readygila.com,
right,
READYGILA.com, that has a ton of information from the county out of Globe that's giving helpful advice and resources.
And our supervisors are on top of this, and our health department, Tommy Martin and Woody Klein, I talk to them frequently, and I know Tim Humphreys is the same. They're on top of this, and they're very active and in communication with me most, if not all the time. And they understand how to manage this stuff. But we are, the government, we're talking with one another, and first responders, and what our job is to get the resources to the community, to our first responders, and keep everything organized and flowing, and keep everybody calm, because there's no reason to panic. Just stay calm. Panic does nothing. I mean, it solves nothing. And the best way to avoid panic is to not panic. Things are under control. They're different. Some things are strained. We're not used to this type of thing in our country. But sometimes God sends you a message and tells you to tighten up what you're doing. And this may be that, But the thing is, it's being managed, it's being handled. And the virus is not a death sentence. There's a very low mortality rate with the virus. The main thing that we have to do is to contain it. And we contain it by staying out of crowds, staying as close to home most of the time, if not all the time, as we can. And trust in me, I cannot close down 87 and 260. There's no reason to. But I don't mean to make light of this situation, but you got to keep your sense of humor too.
Absolutely. Well, one big help will be stopping the charter buses from coming out and cleaning off our shelves. So that was a very apropos measure. There's a lot of executive orders also given by our governor. So if you want to see what the executive orders are, you'll go to azgovernor.gov/executive orders. Is there any other final messages that you want to say to the public, the good people of Payson? You've covered a lot in a very short period of time. Town council meetings, they're going to just be strictly online. No one's going to be allowed to come to those meetings for a time. Is that correct?
Yeah, and that is to protect everybody. The town council does assemble. We do assemble in the chambers. We only have 10 people in the room at a time, and we're following the governor's orders on that. Excuse me, and we are we have the town staff. We are protecting the town staff to keep them, preventing them from getting the virus as best we can. Trying to have people work at home as best we can. We have to keep our first responders. We have to keep government intact. The way to do it is keep them healthy. So the public doesn't have the access it normally has, and I know that everybody understands that. But we are using extreme measures to protect everybody. Now I know there's a lot of people who love coming to the town meetings and sitting and glaring at me. I miss the glares, but and I miss them. You know, we may have differences of opinion, but you know, this is a time for all of us to come together, and this is for the good of the country. After we get this crisis behind us, we can go back to being gladiators and be whatever we want to be. But right now, we're all Americans, and this country is up to us to protect. We do that by protecting each other.
Yeah, it's almost our patriotic duty to do so. We have another question?
If we have time, I think this is an important question. I don't know, Mayor, if you can answer this or not, but
try me.
I'm concerned there is not enough testing being done in Gila County to determine if the virus is not here. The last reported number of tests in Gila County was less than 40 people tested.
Yeah, so the person asking the question is saying that they're very concerned that there's been a lack of testing in Gila County, therefore the virus could be spreading significantly. So what was the last part of it? There's only been 40 reported tests for the COVID-19. I don't know if anyone really truly knows that question, because we just had Dr. Cynthia Booth on air, and I don't think she even had access to that data. I don't know who's recording that data in Gila County. Do you know who is tracking testing here?
The Department of Health, the Gila County Department of Health. We were on the phone. We have phone meetings with them every day, sometimes twice a day. The testing, the test kits have not been. They've been few and far between, but they are coming in now. The president has changed the method of getting the test kits and getting them distributed. What our healthcare providers, like as the doctor said, there are symptoms that they test because there's a limited amount of test kits, a limited amount. The thing that we need to focus on is staying isolated. You know, staying home as much as we can, staying out of groups, washing hands. Don't touch the face. Try not to. Every time I hear "don't touch your face," I immediately touch my eye.
Don't touch this.
Don't shake hands. You know.
Where's MC Hammer when we need it? That should be our theme song. Don't touch this.
And the thing, and the answer, Cameron, to that for me is, this is not the Black Plague. Okay, this is a malaria-like sickness, and we have medicines now to treat it. But developing all kinds of therapies. I mean, almost overnight. So, but people, I mean, there's only a very small mortality rate with this, especially when you look at how the epicenters are New York, California, and Washington, and Missouri are experiencing an outburst, and Louisiana. Mm-hmm. Now, a perfect example of stay out of crowds is they've had a sudden uptick in Louisiana. Well, it just had the Mardi Gras. And they were in crowds, and so that's what happens. The lesson here is clear: is to stay as close to home as you can, and stay out of crowds. Wash your hands, and do things. And when you wash your hands, wash your thumbs. Most people don't wash their thumbs.
Really?
Yeah. Somebody observed me the other day washing my hands, and they told me, "How come you're not washing your thumbs?" I said, "Good." So, I mean, it's just simple things like that. They're just common sense. But folks, we got it under control. There's no need to panic. Stay, really, you stay safe, and just use common sense and wash your hands and your thumbs. Okay.
Yeah, thank you. That was very good. I appreciate you coming today and just soothing some of the panic and the fear that we're starting to see, and we appreciate all the work that you're doing, Mayor. I know it's very difficult, and these are extraordinary times, and they demand extraordinary circumstances and responses. So if we all respond appropriately, like you're saying, stop the panic, stop the fear, stop spreading rumors, all those things are going to really help keep people level-headed and making better decisions. So we appreciate you today. Is there any other closing questions, Cameron? Because we're going to sign off. I wanted to thank you all for joining us today. It's been a really important show. Please continue to share this, get the message out, and we'll do our best to show up next month in April, and we'll give you an update as to where everything is. If you want information, remember to go to azgovernor.gov, readygila.com, and the Town of Payson website, and tap into some of the resources that are available, and we'll continue to provide excellent information to you as the mayor has already done today. So thank you.
Thank you
very much for being here. Thank you for joining us. We'll see you next time. Until then, stay safe and be healthy.